Saules ado ang tutao bodo mu ritial talk show lo bato orang lungu. Mungul lam odang sa maklubkan labora di tal Dios ngarabab. Rubak Dios ka ola ba avec klisi avec tago yang arola imam ka marous oregde ersel soamal al time soamal manner el alsil selingi ako trurior aging artiang imong aringia kimo sa del mora aradra blu magyolungitra aungil luldaso maungil reng mablakatak el deledas el toy el mora rogul adel seberi loreng sertiang marmo oreng sertial toxiora riul pol seberi el maurits to themselves bol lomtab direct kal bol connect aware bol connect agil togo el maclo tutelel el sebel mong sutrir arbeklad el Alzheimer crisis magi olingit segi del el blessing serga ramalios bomong tikai gertial talk show marbek avec kal togo el momdung ma avec kal el luldasol el momdel pol sebel motmak bolong otmok raklo lurior el mongil el morarbek adrablu manguidat agi man meringa sulem magiol kita kal togo lo bangkle la Dios el adam ma Dios el ngal ma Dios el darling amen.
Sulang Wilson dongit Dr. Dela Cruz, can you start our program?
Hi, good morning to our dear listeners. Good morning, Mr. Talams. Okay. These are difficult times as the number of COVID-19 cases are increasing in Palau. The fear and anxiety within the community is understandable. The accompanying feelings of anger, depression, stress, and uncertainty can be overwhelming at times. These may be extremely uncomfortable and unwanted, but may be considered normal reactions during abnormal conditions such as this pandemic. However, we cannot afford to let it take over our thoughts and emotions for a long period of time. We are all in this together, and we must work with one another to get through this crisis. While we should be updated of the current status, let us choose where we get our information. It should be obtained from reputable, reliable news sources. Rely only on official releases from the Ministry of Health and Human Resources to avoid confusion, fear, and anxiety caused by fake news or unfounded claims from social media. Don't share unconfirmed reports to anyone. Should you experience persistence of uncontrollable worries, you should take a rest from social media or the internet. Let us adjust to what the current situation is in terms of reality. That is, we should be mindful of the moment, of what really is happening. Okay? While COVID-19 cases are increasing rapidly, the majority of those infected manifest with mild to no symptoms at all. We can attribute this to the high vaccination rate of Palau. The few who develop moderate symptoms are those who are unvaccinated or those with comorbid chronic medical conditions. We should encourage the unvaccinated to get their vaccine soon, as there are still vaccination efforts ongoing. We should remind everyone to practice safety preventive measures against COVID-19, such as the following. Okay? It has been said so many times, but still, we should always remember to practice frequent hand washing with soap and water for at least 20 seconds or more. disinfecting with 70% isopropyl alcohol, wearing masks especially when indoors or in crowded places, practice social or physical distancing of 6 feet or more, avoid touching your nose, mouth, or eyes with your hands because those are the entry points of the virus.
Let me translate and then we go to
Okay.
the syndrome. Okay, malung tutaw nga kakukti soal mosmada asesere kay blantung atoktang ti summarize kay blantung otokor belaw mangulmo ulo ay sak mas sa kadang arakman maling time malulsi sa vertel pandemic mang kad albang rarak te albang level do ay kal rungu do macho serigid ma feelings serigid ni ati dekal mo mo maring la rungu do mau do sweder le gadulsi sa vertel pandemic al dial sa mal sa eden mingis mo ka ang rarikid el girel leng rak to mengiren mo rogi sel kalsel a opom se tarak to mandi masaka ka to taka ngali kay ngasew el mga tmok lay gel ngal aled Michael se edel gut mok el girel tel pandemic mo madengay mo kwase ndi ngi la bol si barungu de stress le tianga abnormal el time tianga tianga hutsul time le tial tora covid-19 abs makadam suberingi el si suberingi mang el mga ngod at omra le tial rak ta maka ta at tele da to sub akter gid ma balwad el girel tial covid-19 mang سب الشان صلت السود مع نقول رح مالتي مريء التايم قد مريء الموفقيك لمريء المومضاق من قال تقطع مقواسين تيانا نورمال الريسبانس جيد نورمال الثلاث لذا المو مريء الموفقيك لمريء المومضاق تمو شوف غارغود إذا لك المو ديمقرني يا أسترس ومعناس أرين لين قلتوا يرسل تاخذوا ذني إكمل مريء الشانس أتقول جيرة لما information جيرة لكوفيد 19 ما يجانا نورمال الريسبانس جيدار عاد المرة جيد التقول تاخذوا ذني دي كيل دوب ما قد دير خمسو بريني دير خاطر ذني أقوم ما قايل مسودل إمنا مسوي سبريني بتوقع أيجل لغويا أدرى MHHS أكمل جيرة دل تيراك لا يجانا بأس تاخذ بالأوي كنت مقل الممرو لما ngose bakarungud mal ube ngas arungud engal tokta mukwase aige ya normal mdi mukwase ngire del malas mal adjust msub mo practice aige del measures msub mo address الغرسل كوك تلم مسل تيدر قلت بام المايندفول من دغب اريجا الانفورميشن من السال مالوس أصبحي يارعوم المورا بوينت المودع السبب الميموك الموك لا يجل سيونا لقلنا الرقارة بكل سيلز مقاسة يجي يجي البيبي لا تقص هذا الموك لا بول كلورعوم ممورين سايجل مرال التقوي الجيل تيال كوفيد 19 لقدي مورين سا تيجيني للعاد وما خوك تيتلو هذا الأيس نيلتيا إيمال باشول ترقق البومولاي جايجيد الانفورميشن ديل تال سيجيد أني يقمسل لبول المينستري راهيلد أيا أمورين سرني للطوف دا يجيل أبديت ما يجيل الانفورميشن جيل تال كوفيد 19 لا غادي دورين سابق بدين لا تقوي لدون أني بول السبق عرمود والأوبة بأيمل رليد المو قصقود لو تسويد ما سين alsogum ko manna mo to ko meng se ko rakman la mo se barungum e ko mongoli a rasio mongoli a Facebook on social media e ko relax al talgib e mongi la atoko era Ministry of Health and Human Services malakal albebi la tokol drinks of course yung PS al tokoy qadam dakt al tokoy mang ngire del mo lalak le omdas we omtabak mungurasab egremul e mo madengek mo se yes so kum to el PS mal ubende ko dengay oy ngosabik iyarung metil anormal ndi ngaringi yange so el seb el gutmok lakaw ma ospital adile klorion mo tmok legel kuktungul mora o mo tmok la badengay madalang aklet fom blo oy melval imam lo basop maral Pablo all disinfect lo bang alcohol at least 70% al isopropyl alcohol Pamlo maskara alsela apply mal ubang kosokoda ng magsega del pasyo practice a social distancing mga rider kami manda at least 3 to 6 feet e direct ko da kamarut ramadam may sngem mangarem ay kita ko pebi la bladong egit tolomolum.
Okay. So while Palau has only started experiencing what the rest of the world has been going through for the past 2 years, the tremendous stress, anxiety that has been associated with the COVID pandemic has brought about this term called the COVID stress syndrome. So, COVID stress syndrome was associated with a range of pandemic-related phenomena, including avoidance of supermarkets and drugstores for fear of infection, fear and avoidance of healthcare workers, also for fear of infection, and the use of personal protective equipment, masks, gloves, and visors. And there are also incidents of panic buying, stockpiling of supplies in preparation for self-isolation. So the COVID stress syndrome is also linked to a lesser extent with belief in COVID-19 conspiracy theories. So like what we have said, please choose your source of information and avoid sharing any misinformation or fake news because that adds up to the stress and anxiety in the community. Okay? So, COVID stress syndrome is also related to socio-economic concerns. As the world has been experiencing this for 2 years now, there have been economic losses experienced by a lot of countries, even those who are developed countries. Okay? So there's also a thing called Xenophobia, or those who believe that the virus is caused by race, which is from the Chinese. So they tend to be racist and discriminate against Asians, and that has been happening in some countries, and that is so far in Palau it has not been reported, so that's a good thing. Okay, and of course this crisis has been going on worldwide for 2 years, so it can really be traumatic, especially for the children, because the children they react differently compared to adults. So we should all be careful in how we project ourselves to the children and to also to the elderly, because they are the ones who are also most vulnerable to this crisis. Okay, so we should stay in touch with our families, our grandpa, grandma, the elderly who live in the outskirts. Okay, we should keep in touch with them so that they will feel our love and support. Okay, and because the persistence of the fear and anxiety can lead to traumatic stress, and if this goes on for a longer period of time, then it can actually be transferred to the younger ones. Okay, there's what we call the transgenerational trauma, okay, which can be transferred to the next generation, and that is something that is we should seriously monitor and look into. Okay, so we should reassure our children and adolescents that we are there for them, that we will be there to protect them, so that by protecting ourselves, we are also protecting our family. And like what I said, we are all in this together. So you protect yourself, you protect also the community. Okay? Then there are those who do compulsive checking. They want to be in touch like every second or every minute of the day with what's going on. But information overload can also cause COVID stress syndrome. So if you're feeling overwhelming stress due to the need to stay updated, then you should also take a break from social media or from the internet. Okay?
Okay, tokta lilu lang mamsaw dara COVID stress syndrome. E ay nga el gukora treta el gida ugel mal ube gida mo so isa beringi because ay el da sueda marungu da gida el tel COVID ay el seba krenga da gida el tel COVID 19. Ya bebi ay gida el toko ya way panic buying kamal kora silang kawok masuot yata ka nangarang aling kamal stress to the point like on diak mal mas maokraw da swem gilel maka kangun mo sek mo yata ka nangarang tiyati tere tiyang apart tara how you cope ra COVID stress syndrome hindi kan maral coping ngul false coping ang kawal ava kapas o I'm stress tadi ka mo denga ya reaction or kan mo tagi del stress ak mo o tadi ka langarang kamangi kare tel COVID-19 mundi ka tugud as it really is ka kurati ngol kali mal ube ka kurang mo tadi ka san ngarang awan ringi ya maseng gal protective measures gal sanitize ma kokora kokoisur kamal mo mis mo compulsive to the point ka kamam alaw di sanitize di malem leng tagi ko stressed out gidel madya ka suakan mo smering madya ka suakan mo tiaraktan may makamam alaw ko tim asang di sanitize di hindi ako busy at ko di aboy at hindi ka may hindi ka porke hindi ako borangi di basyo le ko mal stress di madya ka suaman mo tiarak makukuklara avoidance maka-isolate ka di ako mo mais di gel di sanitize nangaringi ako kumukwaset tiarakta al diliar ade oliu leringi makukuma racist at parte tagi da kuma se on diakta ko vida ko dirar ada miruringi o palo ol serar at makamna mo racist gidirar at thankfully hindi nakakalbol ngayon nga reporter bela other bela wati akalwaisay. And then ngayon ako traumatic stress kada malimis ramadak tuwer kad almost ora adakal salsab eden masyaw rigid maklanga rigid kordi madak atok tanga dila kon milo ko mo kwasengira den mo karikik at tidakal angal kamal elderly let the mal vulnerable man sabarin mo smer mal up en sa eden ko osisibi tagi del doctor ti man dia sal madinga di dakte mataletelet et subi di de moringi transgenerational trauma ese so adal dia da bodo sisbringi lengrulin moksera adal di madak man dia sab edal hida dia edal mo productive ang mukwasa so kum katat dirgal suwam informed ratto ko era covid di sel aringa la time di mo suvel gidel tel covid di mo rengs information di research en di man mas anet sergawe mukwase nsemel kuk ongli ni outli le emge ko kawel mala sesel information yak malungi la omotor ka clean di imol basyo omola ya gidel masukum hospital o loya information na gidel la covid di ligay gid omoreng se omoltaw. Of course, ang semen mga adurak expert na kinalagang mong mokal aklaw ta swim. Ekit tolomolum.
Okay, so as I've been saying, while we have been experiencing this for the past 4 weeks, I believe, the other countries have been experiencing this for 2 years or so. So, in a way, if we try to look at what's happening right now with Palau and be mindful of what's going on and being in touch with reality and adjusting to it, okay, I'd say that we have a head start of 2 years because we were able to build up our capacity in terms of our capability in testing and treatment. We have our friendly countries to Palau like Taiwan, the US, who gave us support in terms of not only financially but also in terms of equipments like donating ventilators and other medical supplies, protective equipments, okay, and also providing the technical know-how and clinical experience that they got from the pandemic. So I believe everyone must have heard our CDC doctors who have been here, Dr. Thane, Dr. Richard, okay? So they helped us a lot in terms of showing how to manage those who have mild symptoms in the alternative care site and how to administer the medications. And so we also are getting the new medications that are available from the US, okay? So it's a good thing because we are able to treat the community, those who are having mild symptoms with these new therapies, okay? And as we have seen in terms of the volume of those who tested positive, they manifest with minimal to no symptoms at all, showing that the vaccination does work, okay? And that is something that those who are unvaccinated should really think about and consider, because it's not just about you, it's also about protecting your family and our community, okay? So I hope that it will encourage you to go out and have the vaccine, okay? And also I'd like to give a shout out to those frontliners, okay? Not just the healthcare workers, but also those who are serving us in one way or the other, however small or big it is, because we are all in this together. And the community has been very supportive. Yes, there are those who criticize, but I can see that majority are following the directives that have been issued by our ministry and our government. So thank you to the community for following the guidelines, and it is your tremendous support and also participation in our testing, in our treatment of the way we are managing COVID. And that is the reason why I'd say that the numbers that we are experiencing right now is within acceptable range, okay? It's not as bad as we thought it was during the start, okay? And what is the virus behaving differently? Well, based on the recent statistics that have come out, the Omicron variant is less, highly contagious, but showing less symptoms. So, in a way, we are still fortunate that the majority of those who are infected is experiencing minimal symptoms. Of course, we don't take it lightly, and we should not let our guard down. Why? Because repeated infection could also lead to a weakening of our immune system. Okay? So we should still practice, even if you already have been infected before, we should still practice preventive measures. That is to protect the other members of our family and our community who have not been infected. So please do not let your guard down. And we are all in this together. So let's work together, because by doing that, we can be able to fight off this pandemic crisis. And as of this time, you can see how resilient Palau is in general in handling the COVID situation. And for that, we thank everyone, because everyone has been supportive so far with our fight against this crisis.
Tok tanga mo kwase kita ko tulmal tanga tele tal to ko vida mlat mau trabek padenge lavalu ete kita ko arvelau maso iso revelau mlamo ewal sande do ngitu ngil COVID-19 endi kita ngal tanga tele mlaringi 2 years el head start tarigid makadam lam subon mo smau malabal sanitize o mask social distance kidal belaw adar belaw ko tulngal tangataleng botokar sa lidan nga raikel belaw maalsel belaw lol nga sa rigidal el altemela pandemic matamladar sanges raw do dum orus sa vaccine ma PPE ay gal mask ma protective equipment direklem la nganya toktang ra CDC mataywangan lamen ngo sugit el build the capacity git ar adam hospital mablu ito direct kalme answer a question ng kita tel COVID-19 makadang maya ko makay first hand information na atra CDC makadakot ngal tangate mereng asuli our frontliners ra ready ra vehicle seals sa loru our frontliners at the other hospital tabek padingir at direct man mereng asula la community ra yel imori ra lol laang ay tirgel mlo ngu orus mlo test ma aruldar sa nglungu o mauldar sa kal ma akukti create ma nga sulit tirgal frontliners no matter kung wangarak lunga lang soldado si at klaw malgekare mading lungu umalo malat ngotol ngo suwit tial process rigidal lulsis vertial COVID-19 hindi kanges will too small ngiro ko mal appreciated mokomotan musulang adra buhay maral lo takang lol ngoseur adra blue other hospital lo makamater tiat tokora COVID-19 landakal sab LD other hospital kidal other bela ro kuy practice a social distancing o mask sanitize gid makadal sisabtyang masap akria rigid mar other belaw nangal tokang mo kwase repeat infection ako tel possible nganya te elem lemuton mos mera COVID-19 al sum kamla mo positive manghukwa se masum kamla mo pa na mo positive em la recover please dir kam practice ay gal preventive measures le natama se overtime masum nganya repeat infection nganya te elel oitura immune system raw ma kodalingit takmu dolomol mal sanitize edo mask edo labal edo social distance mal protector raw direct protector a neighbor raw protector telbalwat leng ngalinya booster sa ngalinya orus ma anya sol blata ngay direct ngalinya galgara nila adra CDC may mang kodolablo mukara adan mo positive lo ko talgib el hidoya a symptoms tir mangalingi andi agiman mera sulir atra belu el group mera take it upon themselves practice aigal protective measures let's say number 1 el nges was mera sub edel ngosu qaw tal out edira kan ngosu ira tal adanga bitar qaw so kama mera sulir at for practicing the protective measures leng protector qaw protector community kita say mera flow el ngosuit yan fight against the COVID-19 na blue bela will di mo kotyal vaccinate masuk mandir ka mga orsum please mo mesay ka schedule omru sebo mga orsum eng maral sob aklaw tiga ro ko imla mos mera omicron tal omicron na malimis el buko yuyu ending most atom la mos mera ringi ya mal gare symptoms tir mal makasa symptoms tir mal uben dia ka volol oswarak mutus mer because the talorus of malungin lorier to make it either asymptomatic or mal destal amne nos metel COVID no positive me qatalgi luldir qorga symptoms tir mo malorier tal orus como asukum dir ka morus bom psychiatric schedule mo bom morus waigal dilu toktang hindi ka stop practice ay protective measures do not let your guard down nengal niya tele del mutal mo infect eringa latam bom lutal mo COVID mutal mo positive engal niya tele ito immune system raw. Let's continue.
Okay. As we have shown that while physical health is the one that's primarily affected directly by the virus, mental health is of equal importance, okay? As we have said before, there's the COVID stress syndrome. And if we feel that there is a persistence of the fear, anxiety, worries, and as such as already manifested by having bodily symptoms also, okay, like not being able to sleep at all, or having fragmented or interrupted sleep, having feelings of fatigue or being tired almost all of the day, feeling depressed most of the time, having difficulty concentrating at work or in studies, and feeling hopeless or helpless about the situation. If these feelings and symptoms have been going on for more than 2 weeks or a month, and it's already encroaching on your ability to function at work, and it's causing distress in relationships, then you might be developing psychiatric disorders such as depressive or anxiety disorders, okay? And depending on the severity of the symptoms, there might be a need for you to be under medication, or you might need professional help from a counselor or therapist, okay? And that's where we come in. And of course, with the tremendous effort that our healthcare workers are doing, and not just the healthcare workers, but also those who are also volunteering for testing, for vaccination pods, and other activities related to our fight against COVID, it can be overwhelming, and it might cause burnout to employees. And that is why our team here, we offer critical incident stress debriefing, or up to the point of crisis counseling and critical incident stress management, depending on the need of our employees. Okay, so we are calling out those who are feeling burnt out, okay, and having this feeling of almost not wanting to go back to work, or feeling very tired and want to quit. Please don't, because we really need each and every one of you at this time, because this battle of Palau with COVID has just started, and we don't really know. Only God knows until when we will have this crisis. But your contribution is very much appreciated, and let us help you by participating in our CISD, or Critical Incident Stress Debriefing. Or if you want a one-on-one counseling, you can also contact our landline 488-1907, or the Community Guidance Center 488-4711, okay, and avail of our services. Okay, we also do psychiatric consults, me and Dr. Sylvia Wally, okay, for those who also would like to see a psychiatrist. However, our clinical schedule at the moment is at a decreased duration because of the increasing number of COVID. But once it has stabilized, then we might open up our usual clinic schedules. Okay, but for those who feel like they need urgent care, psychiatric care, then you may call 488-1907. Okay, and for our other services, Ribka, other services.
Matok tanga di milsado chal
Yes, sir.
alto ko la COVID-19 nagmaset tanga al serang mo chal physical al badangem. Hindi chal lulda sweda marunguda girel chal COVID-19 whether kam los smeringi kam ko ba adult smeringi mal uben gukti o mal kemeringi kam daktan mo o positive adirek los area mental health argaw o nga te los area mental health argaw en bekol sel podosis brato ko el Either ang PS mal ube kada madak ringi eng mo ringi atak te ma akora stress ringi dom bliki kare ringi ese normal luai geri plamtung sel ngalak mo sel point tel kawa atia moru la gel Rurem rapek kalsils mo omongot maklela batenge mandalang aklem rapek kalsils el kalseleng ngerul Sunday or mo komangar erul Sunday engi am la mo medical na mo mental health issue na mo so isbesel kukora psychiatric disorders ngaringi arwa depression ma what else anxiety medical mental health because it's 2 weeks or more or I say uh, more psychiatric disorder or depression or anxiety et yang lolka lakmaseng mal kora maktaktaw ngos araw more point talkawa stobol mga mok or maru like ngar alem masyum nga laklangar ka ra pekal silsir ka et kalsel ngerul Sunday or mo mangal ra erul Sunday et yang osisi wal mora ar adraurio el mo experience sa kuktuduk mong burn out en la mo masaw mal ubet takman naskare raw the swir ikmal tigyal sa arir megi se malakal mo orio et yang normal leng tal tokora covid a pekal sil se clone ngaral el of course tiral adal lorio ringia amal aswara kmukwaseng klon ngora ale gira kal momru rangi yunding ngai nya time man mo kurusya u taswir marandi ora batengi rakmal tikayang se ado o geringi mkwaseng burn out tengal toktang ak mkwase al sukum kal adraurio ramom aswara se mo takang ale may mad adu edrai ngasew ekik malos pergaw kamal appreciated your work as a frontliner, mal appreciated and mal needed. Mangalingi yang yeso el morgaw. Tial toko yak mas atok tangak mo. Hindi tal Diyos sama dingek mo ay ngarangaw labangalel. Kita o labasayin se ekora sa edel besa sayin se kador odar sa kukuraw do swede gila o ngaranga al amo talgibil kabakaklit tial toko bing maral mo tiyak anti atok tangak mo hindi tal Diyos sama dangalise mo ay ngarangaw labangalel. Ngal tok tanga direk kam lomas ay gel baby na services selngi available makmongut tial ol yung masa Ribka mong mokmong ay gigit. All the services.
Are you done? Are you done? Other than the services that Dr. Dela Cruz has mentioned, we have addictions treatment going on right now that's still available for people dealing with addictions and substances such as alcohol, drugs, tobacco, and any other addictions that you'd like to take care of, especially during this pandemic. You can call our office 488-4711. We have the employment assistance, and I think that goes back to the burnout. If you're feeling burnt out at work, you can call our office as well. Yes, our clinics are limited, but they're available because we know that it's really much needed right now. So please don't hesitate to call. And if you don't know who to call, just call. You can ask for me, Ribka. I'm usually at the office. Or if not Ribka, you can ask for Wilson, who's from the spiritual health. And he has other spiritual health services available. And any one of us here this morning. We're all counselors here. Myself, Rushang, Kendall, and Wilson. And we work closely with Dr. Dela Cruz right now, supporting all our services. Did I miss anything? No.
Oh, thank you. Thank you, Tokta. Sa wala adal mula sa iloreng sitiang, hindi abo ko sa rahmal ko makayak ti magatakal wasi o insegi di kumama based ra behavioral health ako obis nga kanga segi del behavioral health outpatient department yang ya Ribka aru siyang Dr. Dela Cruz direct kalau obis segid ngani atel gibel extended al wing el direct el obis el gim ngani ya gingar segid base segid may dengwal giblabas kami wa igigid en se mil reach kuma medibok te tunga dikwatel gibel te al tunga sesel girela atogora spiritual health matiagi del diru Dr. Dela Cruz lo asing domestic violence ay carousel services ay services el give provider lang ya imoringi Family Protection Act service el domestic violence treatment program say yagup no ra imo mamar counselors ra behavioral health activa se behavioral health and tiaiga services el provided under Bureau of Public Health Rangalela Ministry of Health and Human Services spiritual health malmol mal provide ay el gible provider ang aramong mal primarily basic lumso dela wasi agi link raad la uspera togorang lungu mal uban togora any information regarding atogora klaumarang manglungu agiling services ola ba resources agimla urior gather resources al sila blue alwasi ngarali iglesia etanga urior ngarali iglesia ngaraureri maraad sel low spe malubun soril di mo malengya any information ito civil legal algo lang agi adadu emergo ngakuko besa sel nider ngelade agi i director til mora igegi de lo right el vacío nga diak pastor madiak padre akti aden di kukmla masubal al prepare nga mo sa el help el director adel mora igegi del right el vacío domestic violence family protection act services agi direct providers say Ribka mention a little bit of addictions anger management direct gi provide for and anger management medal way domestic violence treatment program aspect ringi being provided for one services provided for by the community guidance itigay Ribka ngaltiang al coordinator sa el program martatok tangarang ngaltiang magamamarogo at makalkay ngisik hindi domestic violence so kaliduli kasi ay ka nga malamol mal services hindi ka blalbol niya pandemic el stop malamol mal sigumong agibay di engwaret so asi mo magdong al may di mga information album mospe bom du al maneuver adra rangaligi mal ubet adra family members kami do maneuver themselves el gire el muso mi may gay del services makti duli segi din so al di klitrol ngite sa do di pagtaklilo asya to ra klaw marang hospital amalmol mal embargo rato el wasi holistic health holistic health dia kadil togora medical dia kadil medical model dia gidi moro sakar el margong gimel mol la loldu rato loldu niya blul adro gil wasi holistic health maul mang niya gagil services matogora togora spiritual health oldu segid dia kalsal fidule example sa do dia kalsal se bedel ngubetia mental health rap trulad edibol el physical health elo mais ndial sebe dire la se emotional health out of a person hindi ang sel so al emphasize ringi en goret sarbe klada wasi sel bol time a crisis ulaga ng artiang mga le wasi lakada podadak edakay ngese oral das ma emotions aboda ka kled magadong oriakle aboda deeper kidar adam si di mostra time and that salmalos pe kad overlook ayel cliché ang ara alset ayel lurto klung ya el togo el sebe el reach out to ablo el ngirgid klaw marangargid ayget togora klaw marangargid kakaro sa klaw mararar nganya go marangar at togola biblia nga niya gugumarang hindi ka daro gul di nga niya spirituality rigid. Ese yid el spirituality rigid ang aring arbekla ese ya dongole el lo say dig deeper into it. Especially for say au era dotto dia amred sel togoy malubeng yang sarcasm malubeng gora dia kan lungi lultabel el togoy el motobda nga niya kang gesteringi gukmo o ito turar ngula taraat au era the borsay kada mang iya look egora tabra deeper el teletail kada mo matik kada blol mo matik el selungil teletelela da adosa da toy ese gid ya atoy ra spiritual health ngaring irgid magardi mo o kay ngesew el mo lalak kakargera dalonglet share I got information kasabaak and sebe el get through tial pandemic may tirgay da kalik sir ngartiang el mal dia unang asaw le ngarang sel do mesel bedula belu sado yang sab el mesa mal toko lungil klungya el remur terelang maklisi el gida mlamot mager mur kutmok ngawrod at tial rod diguk to mesel tial gobel wasing half empty ese guk decision ra almo se gida guk tara a challenge madik mo se kumal masaw.
Before we turn over to Kendall to serenade our listeners, I'd just like to give the listeners some self-care tips on how to handle stress. Okay, well, if you are feeling tired, there's no other way to go about it but to take a rest. Okay, when your body is tired, you need to take a rest. You need to take a break. Okay, you can take breaks by having doing something that is relaxing. Okay. It can be yoga, meditation. Okay, you can view videos in YouTube which have a theme of yoga or any meditation. You can see what fits your lifestyle. Then, if sleep also is very important. Sleep at night is very important. You should have enough sleep to recharge. Okay, and of course, when you're feeling down and need the spiritual enlightening, then you should practice or pray to your God, because it gives us hope and lifts our spirits. Okay, and of course the nutrition is very important. So eat healthy food and drinks. Avoid alcohol and drugs, as these can only make stress worse. Okay? Any other additional thing, Ribka, before we...
I have to translate.
No.
Okay, mataya ko am no oro kala la tingin lang kaltang ati so alo ay sige la avevira self-care tips. Sel do self-care en ngaon mga tmokra badangem ma mental health ka taking care of your body. En atokta mo kwase nganya time man moskare more tired. Kawas kare do swem badangem itagit sel time gidem rest. Ma kakuk olngul aliway wal klubsay German iway wal klubsay ang ngod omtega na pra during the day masel 7 to 8 hours around iway wal klubsay say the rest tawngin 6 to 7 for adults tokta.
As long as they feel well rested.
Oh, as long as they feel well rested, say liway wal klubsay hindi ka dosa da gen nap para malom say kora power nap. Ngayon dah malungin ngil lamngur ngil nutrition raw kamanga ratapsul blungur ngaringi on round odoy marod mayasay mali makloran orgaba obali marom mo malay drugs laloy ay kang almut el bay to olira stress raw direct el mora yelo lokoya Wilson spirituality raw sukum nga Diyos raw ako malulu sukum ko kadrarwa yoga marwa stretch may yagi ko to relax kan sa emel el practice ay gay hindi rin kakmutok tangak mo sa edalo sa YouTube ang malbak padingay la a video sa lolis at la meditate or techniques for relaxation man di rin ko sa edal employ ya man malaringi ya kom di orang sa patingi wal sukumum namos karem namo tayo ya patingi mo ay sa kakmong ginemen makarang ya malungi la ngin liway mawngil blungur mawngil exercise aquí direct ko sa mamalaw ay sa musel taranges so ngaringi ra averao lol to badaringi ya adra hospital sel ko ka behavioral health 775 to tiang along at mokletira other hospital ma community behavioral health council ongra at taki the service hindi kal tira ensel tira provider mangaringit exist mirko ringi 775 talk etang at 24 hours nga so tengwa 775 8255 tal TALK 8255 nidil time sa emelo mo ko tal tengwa ngaringi trained professional and tal tengwa hindi ka palager ng claim tadi mo oger makaras adil mo sukaw tira ang sukal mo sa kotot kuro babal sab so kuming ngalak kay kal sab adil mo sukaw toro laon mo rin kay nexel at malubeng nexel nga so nga sa el ngosukaw again sel dengwa 775 to abeng wala kal office give labas a 1907 nga 488 1907 4585 ma 4711 ngit taray kan number sa emel kole oger mo nga toktang Ribka Kendall Wilson alakan nga tayo alakan nga siya kita office at takmukha mo ang nga rin mo tama mas kausel mo ko tong sel tengwam sem nam ko tong morti nga ako ngutalo ko yung ulan mo sa Kendall mang mamaskita ko ra closing number oh office
Sadoy, I'll take this opportunity and thank you so much for giving us this hour to come and talk to the people. I was supposed to close out our talk, but they've pretty much already said everything that I'm supposed to say, which are the phone numbers. Please don't forget those. And don't forget our names, Kendall, Wilson, Dela, Cruz, Rusyang, and Ribka. And if you can't get a hold of us at the offices, you can also reach out to us on social media. We understand that the clinics are limited now, so we're still trying to work with the telehealth services where you won't be able to come, and we can try and reach to you wherever you are. So we hope to you, the listeners, that our messages today helps you in any way. Moving forward, some of us are very fortunate to be able to cope, already have all the measures in place and practices in play. So please, to those of you who are fortunate, share those gifts, share those words of wisdom, share those tips to people around you. And then some of us are not so fortunate. Please call us, reach out to us, and we'll try and help you. Sorry, but I forgot to mention, we're not just mental health, behavioral health, and spiritual health. One of our counselors is not able to be with us. She's in charge of the social health services. So this is very important to the elderly population. You can still call these numbers, and we can help coordinate any of the needs that you have in this going on, whatever needs you have right now, especially the social. Just the other day, I helped the old lady, and I was able to connect her to services that she needed. She wasn't able to leave the house, but she called. So those are the things that we can do. So there's so many things available. Please don't hesitate to reach out. And now we give it to Kendall to close us with a song.
Tutas ado ungil tutal mara kamila adara pelu ang klagandal Titiml tan litak kalbo ng itak karingi ya litak ra igalesyal kay kalel meklo en tablo mitak karingi adabli kuma dala ka dili kamal nablo mitak karingi merak guk kon ra igal litak kalsel kora maringi obra adara kuma daswa ka lol ngitak karingi kora mga lakar ngo kumalubeng tiri kalmi alta makuk ngitak karingi marang algi kalom iway bani timan adios sa osigenga ele petigara say